Hey, what's up guys? So today we, the members of Group 10 consisting of Iqbal, Izzat, Muiz, Hilmi and Islah, will be discussing about contraceptions. So let's move on with our topic, shall we? To start this presentation, we would want you guys have some insight on what is contraception and some brief history about it. So according to the National Center for Biotechnology Information, contraception is defined as the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. Thus, any device or act whose purpose is to prevent a woman from becoming pregnant can be considered as a contraceptive. In any social context, effective contraception allows a couple to enjoy a physical relationship without fear of an unwanted pregnancy and ensures enough freedom to have children when desired. The aim is to achieve this with maximum comfort and privacy, at the same time minimum cost and side effects. Some barrier methods, like male and female condoms, also provide a twin advantage of protection from sexually transmitted diseases, STDs. Before the 20th century, contraception was only used with cases related with illicit sexual relationships. It is until after the 20th century that married couples are exposed to the use of contraception. The most primitive birth-controlling method was by coitus interruptus, also known as withdrawal method. Then a contraceptive method developed by the existence of barrier methods of contraception. The first of them was the use of a goat's bladder as a female sheath in Roman and ancient Egyptian era, which they describe as vaginal pessaries. During the 17th century, animal intestines produced condoms by Casanova. In the 1920s, much deeper understanding regarding roles of sex hormones in human beings during reproduction, and thus brings forth the development of contraceptive pill, which now is termed as oral contraceptives. The large-scale establishment of this idea was done in 1956 and since then has been developed until this very moment, where we will be discussing in more detail after this. We will also be pointing out some issues regarding contraception where we have a say in types and methods of contraceptives, benefits of contraception and the risks of contraceptives, and most importantly, the ethics of contraceptive use according to Islamic rulings. Basically, there are three methods of contra which are traditional, modern and surgical. We classified the type of contra under each of these methods. So the first type of contra under traditional method is coitus interruptus or withdrawal method. This method involves withdrawal of penis from the vagina just before ejaculation, thus preventing semen from entering the woman. Secondly, lactational amenorrhea method. This method is very relatable to the full breastfeeding woman because she secretes hormones that prevent conception for about 6 months. The third method is rhythm method. This method requires predicting ovulation, the period when the woman is most fertile. This method is using menstrual cycle calendar for prediction. Next is modern method of contraception. The first type is male condom. In this, a thin rubber or latex sheath, condom, is rolled on the erect penis before intercourse. Secondly, female condom. This is a vaginal pouch made of latex sheath with one ring at each end. Thirdly, oral contraceptive pills. The combined pill consists of two hormones, estrogen and progesterone. This is to be taken every day orally by the woman. Fourth, injectables. These injections inhibit ovulation and also increase the viscosity of the cervical secretions to form a barrier to sperms. The last one is emergency contraceptive pill. Woman must consume 2 doses of the pill, separated by 12 hours, are taken within 3 days, 72 hours of unprotected intercourse. Last method is surgical method. First, intrauterine devices, IUDs. A small flexible plastic device, usually with copper, is inserted into the womb by a qualified medical practitioner after menstruation, abortion, or 4 to 6 weeks after delivery. Second, female sterilization, tubectomy. This is a permanent surgical method in which the fallopian tubes are cut and ends tied to prevent the sperms from meeting the eggs. Last but not least, male sterilization, vasectomy. A permanent surgical method in which the vasa deferentia which carry the sperms from the testes to the penis are blocked. So all of these methods stated had been used by human to prevent fertilization of sperm toward ovum. While Islam regards children as a gift from Allah, there would be some situation whereby contraception is the better option instead of having children. Noted that this discussion is within the context of husband and wife and not sex outside marriage. The first one is when the mother is not in a healthy condition. Mothers sometimes have complications severe enough to affect their own lives if they still want to proceed conceiving and delivering the infant. These complications usually occur towards mother who had been pregnant several times before or was conceiving a child during her 40s. This is because as women ages, the possibility of having noxious diseases like hypertension and diabetes goes up. The second one is during family planning. This is to ensure that the family are economically stable before raising a child. Contraception also allowed couples to determine how many children they want to have so that they can plan on how to manage their income. On the other hand, delaying or spacing babies allows couples to follow education and career goals that may be interrupted by having children, like pursuing doctorate degree. The next one is to reduce rate of abortion. Abortion is an unethical act and is universally condemned thereafter, unless to save the mother's life. According to worldwide estimation, 75,000 die following unsafe abortions. Contraception will prevent unwanted or unintended pregnancy and thus reducing the rate of harmful abortion. The last one is to improve the health status of infant. Contraception allowed couples to have a healthy baby at the right time. This is because infants might face complication if the baby was to be conceived at a risky age, whether the mother is too old or too young. Since the mother's condition affects the infant, contraception permits women to avoid pregnancy until they are more emotionally and economically prepared to take care of a child. Contraception or birth control is designed to prevent pregnancy, which is work in preventing sperm from getting to the eggs. However, it had their own health risks that carry risks of mortality. The first one is allergic reaction. Condoms are made mostly of rubber that may produce itching and edema of the penis that may lead to acute dermatitis of the whole part of sexual productive area. Birth control pills are made with inactive chemical ingredients such as nonoxynol 9 that cause rash, itching to the female sexual area. Neuvering, a vaginal ring may cause tissue inside vagina to become irritated, swelling of face and hives. The second one is contraception can lead to cancers. Breast cancer risk is higher for women who used hormonal contraceptives than women who do not. The risks also increase for those who use hormonal contraceptives more than 10 years compared to those who use less than 1 year. Risk of getting cervical cancer increase as time of a woman uses oral contraceptives increase. Birth control pills are prescribed with man-made version of estrogen that promotes the development of breast cancer. The last one is ectopic pregnancy. Sites of the implantation ectopic pregnancy are in the fallopian tube, ovary, cervix, or abdominal cavity. In almost all cases, the embryo dies. There is an increased risk for an ectopic pregnancy if the pregnancy occurring while an IUD device is in place. When the morning pill is used and fails, there is an increased risk for ectopic pregnancy because the pill has a high estrogen level. Ethical issues are one of the aspects that need to be considered when performing contraception. There are few arguments regarding the ethical of the contraception that can be classified into several groups. Firstly, there are few arguments and positive reasons that support the belief that it is right to allow people to practice birth control. One of the reasons are human rights benefits in the aspect of procreative liberty. From the aspect of the family, it can help to prevent the conception of children that a family cannot support. On the other hand, there are few arguments against contraception. One of the reasons is that contraception brings bad consequences, such as it can put someone's health at risk and can be used as a eugenic tool. Next, that contraception can lead to immoral behavior because it makes easier for people to have sex outside marriage. But there are few ethics and guidelines that can be used to avoid misuse of contraception. In the aspect of medical ethics, there are few ethical issues that doctors and other medical professionals face when giving advice regarding contraception. The primary concern is the welfare of the patient concerned. Firstly, the doctor must respect the decision made by the patients unless there is a medical reason that is against the decision. The doctor also should make sure that the patient gets enough information that they need in order to be able to make decisions wisely. The principle of informed consent requires a doctor to make sure that the patient is aware about the risk and consequences of various methods of contraception. Lastly is the ethical issues from Islamic views regarding contraception. From the principal source for ruling in Islam, which are Al-Quran and Hadith, there are few aspects regarding contraception. Firstly, from Al-Quran, there is no text that explicitly prohibits the use of contraception. From the aspect of Hadith, there is narration which indicates that the Prophet knew regarding the birth control and permitted it in appropriate circumstances. The Hadith mention and describe the birth control method, which is azl, that is also known as withdrawal method. However, contraception method that do not prevent conception and can cause a very early abortion are not allowed. From this it can be concluded that Islam allowed the use of contraception as long as it does not lead to killing the embryo after its formation in any stage of its development. To wrap up our discussion today, there are many aspects that need to be investigated when using contraception. After weighing the advantages and disadvantages of using contraception, there are tremendous advantages that can be gained from using contraception. There are many methods of contraception that can be implemented to avoid unnecessary abortion. The method includes traditional methods such as withdrawal, modern methods such as oral contraceptive pills, and surgical methods in which some of it are permanent. Some benefits of contraception are it helps to preserve health of the mother, help in the term of family planning, and help to reduce rate of abortion. However, there are some risks when performing contraception. Among the risks when using contraception are it can cause allergic reaction, cancer and ectopic pregnancy. From this, many ethical issues argue about having contraception. For instance, from the medical perspective, the doctors need to explain precisely about the contraception method and the consequences of having it. In the view of Islamic perspective, there are hadith that mention about withdrawal method and it is permitted. From this, the scholars have agreed that any method that has the same purpose as Islah is acceptable as long as it does not have a permanent effect. Lastly, that we want to truly emphasize throughout this project is that contraceptives are still just tools. Just like weapons, gadgets and commodities, it could cause war or it could spread peace. It is the individual themselves that put a label whether these tools are good or bad depending on their use. Because of that, a sufficient moral and ethics must exist in all of us, and this is what Islam had taught us right from our first breath until our last shahada the day we leave this world.